Hello, good evening, and welcome to this week's episode of Let's Talk About. Let's Talk About is a midweek live show that borders on social issues and religious issues of today's Christian. We air live on the social media platforms of the Trinity United Church, Legon. Over the weeks, we've had very interesting topics we've been discussing, but today we are discussing something very critical but important, breast cancer. With me, I have two lovely ladies, Dr. Sena and Dr. Iradua. But for the purposes of this discussion, we are going to make it casual and address them as Sena and Iradua. Yeah, welcome.
Thank you very much.
We're happy to have you. The interesting thing is that the two ladies are actually members of the Trinity United Church and part of the youth fellowship, and they are health professionals. We'll dive right into the discussion, but before that, we'd like to remind you that we are streaming live on our social media platforms, Trinity United Church Legon, on Facebook or YouTube actually, and on our WhatsApp number 0501 579 996, where you can send in your questions, your suggestions, comments, and any other thing you may have. Thank you. Welcome, ladies.
Thank you very much.
I feel so bad. I'm not wearing pink. Why? But we'll take it. We'll start the discussion right away.
Sure.
When we say breast cancer, what actually is breast cancer? I'll start with Irajua.
Sure. So breast cancer simply means a cancer that affects your breast. And a cancer is any abnormally growing group of cells. I'm sorry to be a bit technical, but
okay.
Any abnormally growing group of cells that eventually spreads and brings about dysfunction in the body.
Okay.
So when we talk about breast cancer, we are just talking about a form of cancer that originates in the breast.
The breast. Okay.
Yeah.
Sana, do you have anything to add to that?
Okay, so I'll just go into a few statistics in Ghana. So worldwide, breast cancer is known to be about 25% of all female cancers in the world. And in our part of the world, which is the developing countries, is the leading cause of female cancer deaths in Ghana. Also in Ghana is the #1 ranking female cause of cancers in Ghana. So that's what I have to add at the moment.
That is not good to hear at all.
Unfortunately.
Yes. Now you kept on mentioning the cause of female deaths in Ghana, of course, with the percentages and all of that. But who gets breast cancer, or who can get breast cancer? I'll take it from Sena, then we go to Irajua.
Okay, so anybody who has breasts can get breast cancer.
Okay.
Fortunately or unfortunately.
Okay.
So females can get breast cancer. So breast cancer is predominantly a female-related cancer.
Okay.
But because men also have breasts, they do get cancers.
Okay.
And they do get breast cancer. Worldwide, the percentage of males that get breast cancer is about 1%. But here in Ghana, about 2.4% of all male cancers are accounted for by breast cancer. So even though it looks like breast cancer is not common amongst men, as many people think it is still prevalent in Ghana. And day in, day out, people are diagnosed of breast cancer, men, female as well.
I was going to mention that it looks like only the women come out, because I have never seen a breast cancer victim or survivor who has been male. And is there a reason why you think women are the largely affected group of the cancer, breast cancer?
So, it's usually, we have a few suspicions, okay? And one of the things that make it more common in women is that the hormones that we produce, it makes us more susceptible to breast cancer, especially with the onset of menopause. So you find that breast cancer is more common in women, especially after the ages of 50 or post-menopausal. Then you see a sharp peak. However, of late, we've seen a lot of young people also coming out with breast cancer, and this is quite a worrisome trend. There are other things too, such as obesity, because women tend to put on a bit more weight on the average than males as well. And then also other things which we really don't have anything to do about, certain things like our race, because black people are more inclined to get breast cancer. Increasing age, you can't do anything about it once you're increasing in age. And then also a family history. If you have people in your family who have had breast cancer, you are also a little bit more likely to have breast cancer. And everybody has a mother
Okay.
You know, so once a mother, an auntie, a cousin, sometimes even a daughter has it, your risk of getting breast cancer is a little bit higher than the average population.
Okay, so you mentioned that these are suspicions, so
Right.
they are not proven.
So they are proven in the sense that once you have some of these things, your risk is increased.
okay.
Yes, but it doesn't mean you automatically get breast
That's
cancer.
fine. Thank you.
Yeah.
So now, what are some of the causes of breast cancer?
Okay, so when you use the word cause, there's no known cause at the moment. But as Irajua said, there are associations or links to breast cancer. So increasing age. But even though we see breast cancer in a lot of old people, breast cancer has been recorded in a lot of young people.
Okay.
Under the age of 20, it's uncommon. But of late, between 20, those who are 18, 20s, in their 20s, breast cancer cases are being recorded.
Right.
Also, the incidence increases here in Ghana between 40 and 49 years. A lot of people have been found to have breast cancer, but increasing age. And now, because of awareness and also because of lifestyle changes and other things, it's also being recorded in the younger people. Another factor is genetics, as she mentioned. So when there's a family history of breast cancer, also there are other cancers. When there's a family history of other cancers, it's been linked to increase your chance of getting breast cancer. So prostate, uterus, ovarian cancers, some colon cancers, those also increase your risk. I must add that in families where you have a first degree relative, so that is your mother, your sister, an aunt, a sibling, or even a daughter has been found to have breast cancer, your chances of getting breast cancer are higher, so higher than the normal populace. But when you have more than one of those first degree relatives having breast cancer, your chances of getting breast cancer are even further increased. Yes. Also, another factor is diet and lifestyle. Over the years, we've moved towards more refined foods, sedentary lifestyle, intake of high-fat diet. All those things have been associated with an increased risk of breast cancer. Smoking, alcohol, these two also increase your risk of getting breast cancer.
And Satunam, let me just chip in. So you see, we're talking about things like smoking. And a lot of people say, oh, I don't smoke cigarettes. But now you find a lot of young people doing shisha. And then you find that you are taking in more tobacco, more smoke than you actually would have if you were even doing plain cigarettes. In the same way, somebody will say, oh, I don't drink, hard alcohol. But we are taking in a lot of mixers, a lot of spritzes. And all of these are not very high, but they all tend to add up. And I'm so happy that Senna mentioned the sedentary lifestyle. We've all grown used to, sitting at one place. Most of us work desk jobs. We don't do a lot of exercise. And what we are recommended to do is at least 4 times a week, you try to move yourself for 30 minutes. You don't necessarily have to jog. It can be a walk. It can be just maybe lifting weights, something. So you don't need to go to a gym. And even that 30 minutes, it doesn't need to be a 30-minute block. You can do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, and it still also counts. It all helps to reduce the amount of, it increases your activity level, which helps to prevent breast cancer too.
So something just crossed my mind. Accumulated stress levels, do they play a role?
So not directly, but once somebody is stressed, definitely we pick up very bad habits. Once we are stressed, we don't watch what we are eating. A lot of us don't exercise. We are less inclined to do things which are healthy or good for us. So in that sense, yes, increased stress can make you more likely to develop certain
Thank you. I'll still stay with you.
Sure.
I'd like you to give us some of the symptoms, both the early and the late, and if there are any others, send our add-on to them.
Okay, so it sounds very frightening, but I have to mention that sometimes during early breast cancer, there's literally no symptom. A lot of people don't show any signs. Because of all the breast cancer awareness that has been done now, everybody has heard that if you see a lump in your breast, you should be thinking of breast cancer. It can be a sign, but I would also want to say that it's not 100%. Not every lump in the breast is breast cancer. There are so many other things it could be. But apart from the lump in the breast, we are also looking at other changes. It could even be something as insignificant as a rash on the breast. The appearance of the breast can look like the skin of an orange. There's a technical term for a peau d'orange. It just means orange skin. And once you find your skin, the skin of the breast looking like that, you should be a bit concerned. It can just be a rash. You can even just notice a dimple where nothing was there before. You can notice that maybe your nipple has gone inside when it wasn't normally like that. It can be a bloody discharge. It can be maybe it's even something like milk coming out of the breast when you are obviously not breastfeeding. So anything out of the ordinary, really, which causes you concern, should let you move to the hospital so that you get it checked out. It doesn't mean automatically that you have breast cancer, but you should have that high awareness so that you can get things looked at as quickly as possible.
Before we come to Senna, you mentioned the peau d'orange.
Yes.
How does that look like? Because I know orange skin has like some pores and all of that.
Exactly
So,
that.
Okay.
Exactly that. It won't change to green or orange.
Okay.
It's just the texture that we are talking about.
Okay,
So
so
once
when
you
the
see that,
texture changes,
when the texture changes,
It's
exactly
a
that.
call for concern. Senna,
Yes,
do you want
please.
to add anything?
Yes.
Okay.
So in addition to that, a lot of people just concentrate on the breast, but it's not just the obvious breast we see outwardly. The breast extends all the way into the armpit. So someone may have noticed the lump in the armpit, but just ignored it because the person just thought
it wasn't in the breast.
Yeah, it wasn't in the breast.
Yeah.
So people do come to the hospital and they've noticed the lump in their armpit or just around the breast for months and years, and
They did nothing about it.
Further studies just goes on to show that it's a breast cancer. In addition to the symptoms she added, there may be an ulcer or ulceration or a sore on the breast. So most of those consist of the early symptoms. Here in Ghana, unfortunately, many people roam around and wait till it's late to come to the hospital. So I'll just list a few of the late symptoms that they present with. So with the late symptoms, the cancer is not just limited to the breast, but would have spread to other parts of the body through the blood, through what is known as the lymphatic system. So it can go to the brain, the lungs, the intestines, the ovaries, the uterus, the bones. So with the head, symptoms of the head, they may have vomiting. You may notice some changes in their behavior, so altered mental status. They may have difficulty in breathing, coughing blood. Some will present with bone pain, or before you notice, they easily get fractures in their bones, and then the cancer may spread to other parts of the intestines, which may produce symptoms at those sites.
It's so frightening.
It's not a good disease, actually.
It is not.
It is not.
But the information on it is not so pronounced. I don't know how to explain it, but we'll get to that. Then I'll stay with you, okay? You've spoken a lot, but how is breast cancer diagnosed?
Okay, so when we come to diagnosis of breast cancer, we'd put them under three main categories. So we have the clinical examination, we have imaging, and then the last category is known as pathological or histopathology. So with the clinical examination, that's when the breast self-examination comes in, which I'm sure we'll talk about later, where every female, or now because we know men also get breast cancer, should be examining their breast every month. So for perimenopausal women or women or ladies who still have their menses, we recommend 5 to 7 days after the period to examine their breast, so that you know the normal, so that when there's an abnormal change, you can pick it up and go to the hospital. So that's with the breast self-examination. And then there's a clinical one where every year or every 2 years, you get a health professional who has been trained to examine your breast. So that falls under the clinical. In addition to that, we can take a history, ask you about your family history, so that we know those who tend to have a higher chance of getting breast cancer, and then we monitor them closely. And then there's the imaging, where those under 40 years or at that age, we tend to have more dense breasts. So an ultrasound is done for them to pick up any abnormal lumps in the breast. For the older women, we do what is known as a mammogram, it helps pick up lesions that are early. So I must add that it's not all breast cancer lesions that present as a lump. So in the very early cases, it may be detected by a mammogram, which is like an X-ray of the breast, as a very tiny lesion that may not be picked up on examination. So we do the mammogram. There are other scans and labs that can be done. A CT scan or an MRI can be done to pick up. And then we have the third category, that's the histopathology, where if we notice a lump in the breast, we can use a needle to take a little sample of the breast, take it to the lab, look at it under the microscope to determine, first of all, whether it's a cancerous tumor or not, whether it is cancer or not, because as Irajua said, not all tumors are cancers. Even when it's determined whether it's a cancer or not, we're able to tell what kind of cancer it is and at what stage. So those are the three main categories under which we would put diagnosis of breast cancer.
Okay, I'll come to Irajua in case she has something else to add. But you were mentioning ages at a point for the 3 stages. You said for women under 40 or something, you do imaging, and so you mentioned that some people have denser breasts. Does it mean that those people cannot do self-examinations or physical examinations, or they'll be less efficient? What do you mean?
Okay, so with the breast examination, everybody should do a breast examination.
Okay.
Especially everybody who has breast should do the breast examination. So every month. So with those who have not yet attained menopause, I said they should do it 5 to 7 days after their period, and try to do it every month, so that when there's a change, they can notice. For those who have, the reason why it's done 5 to 7 days after the period is the hormonal surge is low and the breasts are not so painful or dense, so it's easier to examine your breast. But for those who have attained menopause, after menopause, we notice that the breast tends to be a little more lax and then falling. So for those people, they can pick any day of the month and try and do the examination on that specific date every month, so that they don't forget. And then with the imaging, for those who are under 40, with the mammogram, your breast is put between 2 plates and then the X-ray is taken. It's a little painful. So for younger people, we tend to have heavier breasts. So we prefer to do the ultrasound, which is less painful and can equally achieve the results. So that's where the age limits come.
Okay. Iraja, is it safe to say you agree with everything Sana has said?
Just to add to what she's saying, I mean, Sana is on top of her game.
Thank you.
You don't have to worry. But the other thing too is that the composition of your breast actually changes with age. So younger people tend to have what we call more glandular breast. Basically, what it means is that the tissues that they have is more appropriate for producing milk. But after a certain age, it rather tends to have a very high fat content. So the kind of imaging that we use is really also directed by what's the suspected architecture of the breast, let me use that, is going to be used. However, you may have somebody who is older, but maybe has never had a child before. Somebody like that, her breast will be closer to a younger person's breast. So you may need to do ultrasound. And a lot of these things are really principles to guide us. When you see a patient and maybe the patient has had a mammogram, you've not had too much information and you think you need another kind of imaging, you would go ahead and request it. It's not a hard and fast rule that once this person is 40 plus, after you do the mammogram, that's it. You don't do anything again. So that's just what
I'm happy we are talking about screening.
Yes.
Should I allow just anybody to screen my breast? Because now every time you pass by a hospital or a health facility or something, even eye clinics are organizing free breast screening campaigns.
When you say just anybody, like how do you mean?
Who can screen my breast?
So
how do you clinic laboratory assistant screen my breast? You know what assistants?
So I mean, it's clinical people who are the professionals. Let me put it that way. The breast is a sensitive area, so you want professionals. The reason why I'm being a bit hesitant is right now there's a lot of training going on. So there are people who are being trained in breast examination. You know, it's not everywhere. We are in Accra. We are very fortunate. We have a lot of doctors and nurses available. But in other regions where doctors and nurses are not as common, other health personnel have also been trained. So once the person has been properly and professionally trained, the person can do the breast examination.
Okay.
Yes.
You agree? So
yes.
take it. Now there's a popular myth that flies around a lot, especially in October, that sucking the breast actually reduces your chances of getting cancer or helps with the healing process.
Please, it's not
bust
true.
The myth
It is absolutely, completely,
false.
Positively not true. Okay. False. And it's not true.
Okay. Then you disagree?
Oh, I agree with it.
Okay, so please, you can stop telling me.
So what is actually supposed to go around this? Breastfeeding improves or protects you from getting breast cancer. So the cancer arises because there's continuous stimulation of the body by the hormones. So when you are pregnant or when you are breastfeeding, it sort of breaks that cycle or gives you a pause. So increased breastfeeding protects you, or having many children also tends to protect you. But here's the case where a lot of people tend to have small families.
Yes.
So we should encourage mothers to breastfeed, especially to undergo exclusive breastfeeding, as it at least gives the body a break from the excessive hormonal surge. So
please, let's be very emphatic here. It's not the sucking of the breast. It's the fact that the hormones at that point, because it takes hormones, your hormones surge, you have your period, and it surges for ovulation to happen. So it's that break that confers you some protection. It's not the act of the.
Raja said we should be emphatic.
Be very emphatic, please.
So if you've been deceived, please find your truth today. So when you said we should encourage mothers, I thought you were going to say we should encourage people to have more children. Oh. Thank God you didn't say that. We'll continue. What are some treatment options here, Raja, for breast cancer?
Okay, so I would want to start with surgery, not because that's the first thing that we do, but that's what most people are worried about. A lot of people don't come to the hospital because they are concerned they'll cut their breast off. Now, there are so many aspects to the surgical aspect, so I just want to deal with that. A lot of times, especially when people come early, it's the lump that is removed. So if it's a lump that is there, that's what they see. If there's a small amount of tissue that has become cancerous, they take just that, and then they just, that's what they just do. It doesn't make any change. Of course, there'll be a small incision site from where they would cut to do it. They'll give you pain medication, so a lot of people don't even remember the procedure. But the breast itself, as much as possible, they try to preserve it. Even when it's a big chunk, sometimes they may take that part off and then try to reconfigure the breast. Right now, thankfully in Ghana, medicine has really gone forward. So we have a lot of plastic surgeons who are able to restructure the breast so that everything is fine. It's only when it's so advanced that we may have to do the mastectomy. That is when they take off the breast. But even that, when they take off the affected breast, they are still able to do plastic surgery to reform the breast so that you still feel confident, you still feel like yourself when you're going around. But that's just one aspect of treatment. There are other things like chemotherapy, where they give very strong drugs to you. There's also what we call radiation therapy, and that radiation therapy is when they use radiation like the X-ray, and they put it at the affected area, usually the affected breast, to help to kill the cancerous cells. And then we also have hormone therapy, depending on the kind of breast cancer that you have. You remember when Senna was talking, she talked about the pathological diagnosis, where they go and see the exact type. Some types of breast cancer, they respond to hormone therapy, so they may give you hormones. But if your breast cancer does not respond to that, then that also wouldn't be given to you. But this is all just, should I say, the technical side.
Okay.
There's also a lot of non-technical things that we need, and I think that's where we really need to focus in Ghana. We need a lot of psychological support for our breast cancer patients, and a lot of times we try to encourage them to see a clinical psychologist, to see a psychiatrist, because a lot of them deal with anxiety, they deal with depression. You know, why is this happening to me? You are in a church, you pray, you give offertory, but you are the only one who got it, and you feel that it's a bit unfair. Why is this happening? So they tend to need a lot of support. And then also, all of these treatment modalities, in as much as they help to even cure breast cancer, because breast cancer is one of the few cancers that you can actually cure if you catch it early enough. But they tend to need a lot of support from their family, from society, from the churches that they attend. And that's where a lot of people find that lack, because naturally Ghanaians are very conservative. People don't really tell people what's going on,
right.
So we are not able to support them, and sometimes the family members don't know how to deal with it. Hey, this person has breast cancer, you don't know, is it infectious, is it this, so you don't know how to treat them. But they need support. They need people to go with them when they are going to the hospital. Sometimes when they undergo the chemotherapy, by the time they finish, you know, they are feeling a bit dizzy, they are feeling a bit weak, they need somebody to hold them. Sometimes it destroys their appetite. They need people who will be able to help them to feed. They need people to even provide food. We know the sister in our church has breast cancer. Why don't we prepare a few dishes and go and give to her? Because she won't have that energy, the money and the time that they'll need. Even blood donations, because sometimes their blood levels drop quite low and they need transfusions. We may not have it. Our blood banks are not always there. That is where the role of the church and the community that they find themselves in comes to play a role. And when you get all of this, that is when you really get a holistic treatment for the patient. When you focus so much on the surgery and the chemo and whatnot, all of those things are there. But you see, at the end of the day, you're a human being. It's not just the body that you need to treat. You need to treat the person's mind, the person's emotions.
Spirit, everything.
Exactly. And so that is really where I would want us to focus on the things that we can do. Not everybody can be a technical person and wear lab coats and go and, you know, take samples, do x-ray or something. But these are some of the things that also help in the treatment of people with breast cancer.
Okay. Yeah. I'll come back to you, but I would like to remind our viewers that we are streaming live on our social media platforms, Facebook and YouTube, at Trinity United Church, Legon. You can also send your questions, comments, or suggestions to our WhatsApp number 0501 579 996 0501 579 996. We would love to hear from you. Please send in your questions and your comments. Thank you. Now we are back. I wanted to ask Iraja, but I made you say so much. So Stella will help you out. How long does the wound take to heal, the incisions? Let's even start from the very small ones, where they take just the tissues, the extra tissues, or the lumps out. How long does it take to heal?
It varies. Okay. So there are so many factors that go into wound healing. So your health status before even the surgery matters, how strong you are. We also know that people who have diabetes and other illnesses tend to take longer time in healing. But within a few weeks, after the surgery is done, a stitch is put in. So in some cases, the stitches have to be removed. Some of them, the stitches are absorbed by the body. So within a few weeks, the wound would heal. But as I said, all the other factors, so you have to be eating well. If you have diabetes or other comorbidities, it may delay the healing. But for a healthy or someone who doesn't have all those things, eating well, drinking a lot of water, within a few weeks, the wound would have healed.
Thank you. Now, saying within a few weeks the wound would have healed makes it look so easy, you know. But let's make it roughly. Out of 10 people who get breast cancer, how many of them may actually survive it?
So it depends, like, on how early they come.
Okay.
Yes. So that's why, you know, it makes such a big deal. Yes, because early detection saves lives. That's why everybody keeps saying it. Because if you have 10 people who come very early without any other issues going on, it's very possible that all 10 of them will survive. You understand? Once they come in early enough, we start the management and the issue we have, like Senna mentioned, is that a lot of people go so many other places, and by the time they come, it's just too late to do anything, you know, significant for them. I mean, we are a church, we are spiritual people, we believe in the role of God. But whilst you are praying, you come and let us also do ours, and then you'll be supporting with the prayers and whatnot, and then together we'll be able to get some good outcomes for everyone.
So in 2 seconds,
yes.
What about those who don't deliberately shy away from seeking help, but actually do not know? Because both of you have at a point mentioned that in the early stages you actually don't even have any symptoms.
That is true.
So would that be my cross to bear? If I come when it's too late, you know, I just realized it and I decided to rush in and...
So first of all, once you realize you come, that's the first thing.
That's it.
So, okay. Now, the truth of the matter is that, like she rightly said, there are a lot of other factors.
Okay.
So when somebody comes, we really need to do a good assessment, not just with how far the cancer has progressed, but whatever conditions the person may already have, you know, and how willing the person is to attempt certain treatments. So all of these also play a role.
Okay.
But should you come in good enough time, or whatever time you come in a good enough healthy state, usually the prognosis looks quite promising. Yes.
Okay.
Yeah.
We'll be taking a quick break. Please leave your questions and suggestions during the break. We'll be right back. Please stay with us.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Hello, and welcome back. This is Let's Talk About, and my name is Edinam. We've been discussing breast cancer and breast cancer awareness in general. We've busted some myths, we have talked about causes, preventive measures, treatment, and many other things. We are kindly reminding you to send your questions, comments, suggestions, and any other thing you may have to our Facebook pages or our YouTube channel or our WhatsApp number 0501 579 996, 0501 579 996. Fortunately, we have a third panelist, and we are very happy to have her. She's Bridget Ampong, a nurse. Yes. You're welcome. Thank you for joining us.
You're welcome.
So now that you have come, we'll ask you or use you to open the curtain for this session. Would you like to share some experiences you've had with breast cancer victims or survivors, if you have any, that's of course.
Okay, if I remember, that was Kolebu Teaching Hospital, and having to talk them into accepting to get that lump out alone, it's a whole issue. You have to involve the psychologist and all that. Talking of cutting it off completely, I hope you get me. And these are women in a low income stage, let me put it that way. Let's say the market women, those who earn less. Yes, so let me say your program, for instance, someone like my mom who sells in the market doesn't even have a smartphone to just watch whatever is going on here. Do you understand? So how do we get to these women? Because they have less knowledge about it. I'm on Instagram and I see us preaching breast cancer, breast cancer. What about my mom? What about that auntie? What about that grandmother at Makola or at Medina Market as well? Whom would just be there and then get to realize at the latter stage and it's too late. Just to talk to let her understand that you have breast cancer alone, they don't want to. So how do we get to these people? That is a question mark. So just getting them or even letting them understand that you have breast cancer alone, it's a whole issue. Talking about removing a lump or cutting it off. So it is very challenging for them.
Okay, so sensitization is an issue.
Sure.
Now, let me introduce your fellow panelists. This is Dr. Irajwa and this is Dr. Sena.
Hi.
Okay, but we are going by Sena and Irajwa.
Okay.
If sensitization is an issue, you know how difficult it is to talk these people into getting, you know, treatment when it is too late and all of that. What roles are you playing as the health sector? You know, I know that when they come to the hospital, they are bringing money in and all of that, but I don't think any of us would be happy in our professions to see, you know, people dying or feeling really bad. So are there any specific roles you are playing? You don't have to mention the names of any institutions anyway, but what are you doing as a person or as a facility with where you work to make sure that these women who do not have smartphones or are not on Instagram and all of that can get the necessary sensitization and information so they don't come in when it's too late? What are you doing? I'll start with you, Ness.
All right, great. Said it now.
Yes.
Me personally, I'm so passionate about preventive measures for one or two reasons. So last 2 years, I organized breast cancer awareness at Makola Market without including the screening itself. Last year, it was school outreach. And this year, I'm making it more than what I did last 2 years, which will be taking place just this Saturday, hopefully. So we are going to screen our women. We've already made them aware that we are coming. And the zeal alone, when we're making the announcements, the stories they share, my sister, my mom, and they themselves, I feel pain in my breast. I see some color change. What do I do? So the zeal alone, they are really willing for us to come, even asking when we will come. So me personally, I'm organizing a breast cancer screening for Makola women coming Saturday, 22nd October. Nice. I've dubbed this Pink It's with Brie and Friends. Bridget, my name. Okay. Pink It's with Brie and Friends. And it's going to be a fully packed session for our mothers. Because there will be fun games, you have company support, and we'll be giving them out products. So the ones that we detect these signs and symptoms, we also have partnered with some health institution where we are going to offer them the pre-mammogram session to see and find out if it is truly breast cancer. Because we know early detection saves lives. So as me personally as a nurse, that is what I'm doing.
I think it's a very laudable initiative.
It's a great.
So we are grateful. Thank you. On behalf of everybody in Ghana. But where in Makola? Where exactly?
STC station around to do inside.
Okay.
Yes.
Okay. That's, I think, opposite the Kimbu sector.
Exactly.
Okay. So if you have any auntie or mommy in the market, you can just, I think we can even go ourselves. But we have an announcement to that regard with concerning the Trinity United Church members, and to come in due time.
Yeah.
The question still goes to you and Sena. You know, what are you doing as health professionals, as facilities, you know, to give the concerned parties, which in this case will be men and women, because we don't recognize any other genders in the house of God. What information are you putting out there to ensure that we are coming and we are coming on time?
So I think we've had a good start with some of the programs that we've organized. This very one is one of them. The smaller groups we also try to reach. A lot of facilities now have taken like Pink October as a thing. So every October you realize that people are offering discounts for mammogram, people are offering discounts and free screenings as well. So you don't really need to go far, especially when it comes to Accra. There are also other groups, breast cancer survivor groups, and they also go around to speak to other people. Like she mentioned, it's not everybody who would have access to a smartphone, to come to YouTube, to come to Facebook. But we are hoping that the ones that do really get to understand the message. And that's why we've just condensed it to early detection saves lives. Because all that we want everybody to understand or take away is that if you detect this early enough, it saves lives. So we want you to begin to look out for it, and we want you to screen yourself, screen your mom, screen your grandmothers who can't do it themselves. Give them the information that you have been privileged enough to get, so that they will also hear. It's like evangelism, so to speak. So as we are spreading the good news, when you also hear, you also spread the good news. Let others also get it.
You can't do everything alone.
You cannot.
That's fine.
Yeah.
I think they've spoken to that issue enough. Would you like to share any experience? Do you have any with a victim or a survivor?
Okay, so I know someone when I was working who through one of these screenings that was done, a lump was detected in her breast. She came in to the hospital, so she went to do a mammogram. They realized it was a breast cancer. So for this lady, the lump was actually in her armpit. As I said earlier, it's not always in the breast. So the various tests were done, and then it was found out she had breast cancer. So a surgery was done for her. Both breasts were removed. The other one was removed as a preventive measure, so that the risk of developing breast cancer in there will be taken off. And then she went through radiation sessions, as Iradra explained, and chemotherapy. And I must say, it's been about 5 years, and she's alive and doing well. She went through some physiotherapy, some psychotherapy, counseling. There was good family support. So she's alive and doing well. So it goes a long way to say that once you are screened and then you are, is detected early, surgery done, or whatever treatment is put in place, there's a good chance of survival. So you need to get screened, screen yourself, get a professional to screen you, go to the hospital. I know it's difficult to accept the truth as it's told, or the facts as they've been laid, but once you take it in good faith, back it with prayers, family support, the doctors and nurses and all other health professionals will do their best, there's a good chance of survival. So that's one of the stories I can share.
Okay, thank you. Something just dropped into my mind. Okay, is there a possibility of a recurrence after treatment?
Yes.
Maybe both the breast, both of them are taking off, or the lump that was seen is taking off, whatever it is. Is there a possibility of a recurrence? And under what circumstances would that happen? Or is that liable to happen?
So, yes, you can have a recurrence. One, depending on, again, which stage. If the cancer had already begun to spread and had spread quite well, then yes, there may be a recurrence at the site. Sometimes when they come in a bit too late, we are not able to take away all the cancerous cells. We take as much of it as we can. So if there's some left, there may be a recurrence. A very, very, very small percentage may. I hope you are seeing all the disclaimers I'm using. Very, very, and may. Yes, may have a recurrence after they have radiation therapy too as well. You know, the X-rays sometimes may cause some growth. So if the person already has the cancer and has the radiation, in small instances, it's also a possibility that that may also recur. So when people are treated for cancer, and even when you are declared cancer-free, you still have to be monitoring. You still have to be screening. You still have to keep an eye out. And whilst we are doing that, once you've been diagnosed and you've been managed, you also have to inform your family members, and that's another area where we don't do so well. So I'd like to appeal to everybody watching that if you have had breast cancer, don't hide it, don't keep it to yourself. you need to let your family members know. Your daughters need to protect themselves. Your sisters need to protect themselves. Your aunties, your cousins, they all need to protect themselves. Because once we know that somebody has had breast cancer, there are certain treatment options that we won't give you, not related to breast cancer. Maybe for something else. You go to the hospital for something else. But they'll say that, oh, you know what? Because this person has had breast cancer in the family, I wouldn't want to give you this. And it helps to, modify your treatment to yourself. So we have to be a little bit open and share when it comes to some of these things as well, so that we don't see the negative aspects of it to the fullest extent. Yeah.
I think in that case, we need more psychologists and psychiatrists, like
Definitely.
you mentioned earlier, because
and
sharing
pastors,
yes,
and youth group leaders, and women's fellowship leaders, men's fellowship leaders. We all have to be
all of us
our brother's keeper.
Okay, thank you. I have a question for Bridget, but I'll take a comment first. There's a comment by Clarence. He says early detection helps, and the cost involved when not detected early is very high, or may even result in fatality. I think we've mentioned that, and that is very true. Now, Bridget, you are more into the awareness campaigns, going to screen our mothers and all of that. Don't you think that it should be a monthly thing and just not an October thing? We stack our pink dresses and everything for just October. Breast cancer will not come in just October.
Exactly.
It can come at any time. So, do you have plans to do this monthly, or you've not thought about it?
Okay, so it's education and the screening. So even if I'm organizing this in October or every October, I'm also educating them. So that's why we have what we call the self-breast examination. So, hey, mommy, a month after your menstruation, that is when she's not in her menopause stage, you have to stand in front of a mirror, put your hand back or lie and do this. And when you detect it, you should come. I'm also leaving contacts as well to them available. So in case they notify anything, they should contact me. So it is not only in October that we should preach breast cancer and put it that way, but it should be, because somebody can get it in February, someone can get it in December, so
even in November.
It's an everyday thing and put it that way. But October is set aside to really announce it for us to. So I think it's even recorded that October we have higher diagnosis of breast cancer in hospitals. Exactly. But as we preach the preventive measures as well, we should also let them know that it's not only October, but you should perform your self-breast examination monthly.
Okay, we'll come to the self-examination.
Okay.
I don't know how physical it can get. It doesn't have to get too physical, but you can give us an idea. We'll use our creative imagination to picture what it is we must do and how to do it. Now, there's a question by Equia. She says, so to clarify, not all breast cancers cannot be cured. I think she means can be cured or cannot lead to death.
So nothing is 100%. So not all can be cured, but then not all too will lead to death. Okay. And there's a good percentage that do not lead to death. It's just early detection that would help.
Okay.
Yeah.
Thank you. Now, before we await more questions and comments or discuss anything further, I'd like tidbits on the self-examination process. So Bridget mentioned something about lying back, standing in front of your mirror, take our imagination on a ride. So I'll start from Bridget. You give us a few steps. I wish you could, do the physical examination, but no, please. So we'll take it from Bridget, then we'll come to Irajwa and Senna. So when you say it's a point, you can leave it for Irajwa. She'll pick it from there, then Senna continues.
All right, so with the self-breast examination, you will need yourself as a woman or a man, because men also get breast cancer in rare cases. And you need your mirror, which shows from head to toe, okay? So what you do is you are inspecting first. So you look at your breast, and when you are inspecting, I'm sure you've mentioned some of the signs you see.
Yes, we have.
So you are inspecting for any color change, any dimpling. We all know what dimple is. So if you see anything of that sort around the breast, and if there is any retraction, you are looking at rashes around and all that. So this is you in front of a mirror. You have to put that in your mind, looking at it in the mirror, then observing it as well. So after that, we come to the palpation. So with that, when you're examining your right breast, your right arm behind your forehead this way, then you use your left hand to palpate the breast.
Not to cut you. but I've always wanted to ask what that does.
Okay.
Your left hand behind your head, all of that. So now that I have the chance, please tell me.
All right. So you said now, as you are sitting without your hand here, I would want you to touch your breast and see if it will really get to the base. Please try it and let's see. Okay. Just that.
Okay.
And then imagine you doing it this way. It just gives you the shape.
More access.
Yes.
Okay.
Exactly. To also, and also, you know, you should also know that you're examining
the armpit.
Yes, because the lymph nodes extends to that place. So if I'm this way examining, of course I won't get access to that part. So that is why. Okay, so you should I continue? Please. Okay, so you palpate in a circular motion. Please, we are using this part of our fingers. So you palpate in a circular motion. Then you come back to the middle part that way. So with that, we are looking for any lump, abnormal lump, and these lumps are usually harder than the normal one we have in our breast, okay? And that one also can move from one place to another. So that is what we are looking for. Then after that, we are also trying to see if you feel any pain in it. And the pain is not the pain you get from touching the breast. But if you feel any pain, let me put it that way, aside not relating it to you, the palpation you are doing, it's a question mark. So when you are done palpating a circular motion, you pinch the nipple to see if you see any discharge. And we have a discharge that looks like water. Sometimes that one is normal, but we have ones that, I don't know, pass. When you have, should I say, pompo, and it get burst, what comes out of it? It's kind of look like that, kind of yellowish. It's not normal, or a bloody discharge. So you just pinch it to see as well.
Okay, thank you. I'll let Iraja take it from there.
I think for the most part, she's made mention of a lot of things. Just a few pointers though, that when you are doing the breast examination, we want you to dedicate time. So it's not something you hurriedly do on your way to work or when you're in a hurry to go somewhere. You set aside some time, like maybe 10 to 20 minutes that you are dedicating to this breast examination. She mentioned that you can do it standing, sitting, and then in other cases to lying down. With the lying down, we are not so much enthused about, because once you are lying down, very few people have mirrors on their ceiling, so you won't be able to really observe. And then another thing too is that when you put your hand behind your head, it tenses the muscle beneath the breast, so it also produces a counter pressure. So once you are also massaging the breast against that tense muscle, you are more likely to find lumps in the breast than when it's also relaxed. And then some of the maneuvers too that you can do, she mentioned you inspect the breast, which is you look at it. If you have pendulous breast, you want to lift it and also look at the underside. You are just not looking at the parts that the mirror tells you or that is easily accessible. And then you'd want to raise your hands slowly together, just like I'm doing. You raise it up high and then you bring it down slowly. And whilst you are doing that, you want to look at how the breasts are moving. The breast should rise in synchronicity and come down. All that means is that they rise together and they come down together. They rise together and they come down together. One shouldn't go so far ahead, you know, before the other, you know. And I always tell my patients that the breasts are siblings. They are not twins. So they won't be identical. They won't be exact mirror images. But there should be enough similarity for you to see that this is a pair. So once you start seeing one doing something that the other is not doing, you have to start, you know, considering other things. It may not necessarily be breast cancer. There are so many other things, issues that can affect the breast. But once you notice that, you may want to go to the health facility to get it checked out too.
Okay,
as well.
thank you. So now you've been quiet for too long. But before you add to that, what should a lump feel like? Should it feel like a mesh? Should it feel like a hard knot? What should it feel like?
So ideally, you are not supposed to have lumps in your breast.
Okay.
But if you do find a lump, it doesn't mean it's a breast cancer.
Okay.
It could be what is known as a fibroadenoma. So that's, I'll break it down.
Thank you.
So it's just a lump in the breast. It's what is known as a benign lump. So it is not cancerous. It usually moves around. So it's called a breast mouse.
Okay.
So it moves around. Before you catch it, it has run away. And then there could be other diagnosis like a traumatic fat necrosis. So usually the patient would say, I haven't fallen or nothing has hit my breast, but it's due to repeated trauma to the breast. In some cases, some mothers during lactation, there may be cracks on the breast from the breastfeeding from the child. An infection occurs. If not treated early, it may develop into an abscess or locally known as pompo.
Okay.
And then it may collect or organize, and then it forms an abscess. So all those are diagnoses that could be entertained. But if you do find a lump, characteristics of a lump that should make you worried or the healthcare worker will be more suspicious is when the lump is hard, it is irregular, so it's not smooth. You see it is attached to the skin, or during the examination, you realize that it is attached to the muscle or it's attached to the chest. And then it may or may not be painful. So those are characteristics of lumps that raise suspicion. Just to add up to the tips, I would say that breast examination is not complete without examining the armpit, because a lot of lumps are over there and then they are missed. And then if you have a family history of breast cancer, you should, apart from doing the breast examination, you should endeavor to go to the hospital at least once a year or once every 2 years to have a health professional also examine, because you may be doing the wrong thing, thinking you don't have a lump, but there may be other changes that you may not pick up because you think are normal to you. So I encourage you to go to the hospital at least once a year, once every 2 years, especially if you have a family history of breast cancer. And make sure you examine the armpit in addition to what they've said.
Okay, I like how passionate you are about the armpit thing. We'll take your advice. Actually, didn't know that. So thank you. Daniel says, losing someone to breast cancer is very painful. Early detection saves lives. I agree. I think we all do.
Yes.
Now we'll take another one. Great topic, guys. Pearl says, great topic, guys. Lots of lessons learned. Is there a possibility that the things we eat or use on our skin can cause breast cancer? This is a very good question. She stole my question, actually. Because one doctor once mentioned to me that the pomade, I think body creams we use sometimes affect us and cause cancer in some parts of the body. Erajua is nodding, so I'll have you take that.
So it's actually true. So a lot of our products, we have our standards board. They look at these products and they screen it to make sure that they don't have what we call carcinogens. These are cancer-causing compounds or chemicals. Unfortunately, nowadays, because of the free market that we have, people are importing all sorts of things, roll-ons, body creams, toning creams, you name it. And some of them do contain these harmful substances. And with repeated use, it's not something that maybe if you use it once, twice, but with repeated use, it can increase your risk. So I generally like to tell people, if you can't read what is written on the can, you may want to stay away from it. Sometimes people buy certain things and somebody will tell you it's tea, and you look at it, it's all in Chinese. For all you know, it's fertilizer, and you put it in your hot water and you are drinking it religiously, like, they say it melts fat, they say, if you can't read what it is, it's already a red flag. But also try to look for some of these products which have been approved by the Ghana Standards Board, Food and Drugs Board, that sort of thing.
Thank you. Reverend Dr. Martin Obing says, thanks, guest and host. Are there some organizations besides the church that provide financial support for those who are not able to foot their bills?
Yeah, I know there are some NGOs, some non-governmental organizations that go around or assist people who need help to pay their bills. So there are a lot of them. Some of these telcos also have some sponsorship, or as part of their social services, provide some help to survivors or people who are going through breast cancer. So
now that you've touched on it, I was going to ask, how expensive is the treatment? Bridget, please take that. How expensive is the treatment?
Okay,
so
for treatment.
Yes.
Okay, so
when you are diagnosed, you have to undergo treatment and all of that. How expensive?
Okay, when you are diagnosed alone, what you go to, that's the mammogram. When I checked recently, is 300 cedis per head, and the ultrasound It's also around 250 or so, and some health facilities are giving discounts on that. But for the treatment, I can't really.
That's okay.
tell
You
for
don't have
that.
to give us a fixed figure. I think it will be vary from health facility
Exactly.
and person to person, depending on what you need, right?
Exactly.
Okay. Kay says, is this self-examination also done by we the men? My curiosity is about the nature of our breast, or better still, chest. Oh, please, it's breast. You have breasts too. Raja.
Oh, it looks like I'm talking a lot.
When you nod or you smile, I'll call you.
I like nodding a lot, so this is a problem. But luckily for the men, the architecture of their breast is such that it's very easy to detect when there's a lump. Yes, except for the those who are very fortunate to have put on some weight, then it's not as straightforward. But even then, it's still easy. They can use these same tips to check their breast and also look for lumps as well.
Okay. Okay. Sorry for making you talk too much, but there are more coming. Are there types of breast cancer? If yes, how do they differ? Sana. Then Bridget.
Okay. So there are different types of breast cancer. They are a bit technical.
Okay.
But how I would approach it by saying that the breast is not just made up of one tissue. There's the skin, the fat cells. We even have the glands that produce the milk. We have the glands that even transport the milk to the tip of the nipple for the milk to come. So each of these cells can undergo cancerous changes. So with the histopathology, it's able to tell us which cell line it is. And then that's when we're able to say you have breast cancer, but it is of this cell type or that cell type.
And that also determines the treatment,
yes.
Right? Okay, Bridget, I'll ask you a different question. Poorly treating a breast wound, can that cause cancer?
Yes. First thing, you are already infecting the wound, and that will not help even the wound to heal fast, and it's going to worsen issue. So even when you've gotten rid of the cancerous cells in it, you're already, and you are infecting it. So basically, in most cases, after removing the cancerous cells from the hospital, these women are advised to come for periodical wound dressing. But some actually forget, or not even forget, refuse to come because of the small money they are going to pay and all that. So you're just infecting the wound, and that wouldn't help. It will lead to another thing.
Okay, that's okay. I think today's discussion has been really insightful. Thank you for joining us. I've taken so much. The very first one I learned was about the fact that the breast extends to the armpits as well. I am particularly concerned about the wound, developing into a cancer and all of that. Is there anything you'd like to add? Because intermittently you may be shaving and then you cut yourself or something,
Not the wound. It's not like the wound will develop into cancer. I think what Bridget was trying to talk about was people who already have cancer and they are asked to come for wound dressing, and then the wound gets infected. Okay. It's in rare instances, like when somebody has a wound that doesn't heal for a very long time, and what we are talking about is years. It's not months. There's somebody who may have a wound for like 20 years and never properly heals. When you keep having that sort of thing, you may develop, but it's not so common. Wounds don't cause cancer.
Okay. Sana, you're going to say something.
It was the same point I was going to make.
Okay. Is there anything else you ladies would like to add? Bridget, I would like you to reinforce your announcement about the macular thing, but let's start from Sana, anything. If you don't have anything to say, it's fine. You can just pass it on.
So my last words are early detection saves lives, and men and women, try and examine your breasts every month. If you do forget, even when the time you scheduled to do it is past, do it as soon as you remember. Men and women alike. Thank you.
Okay, thank you. Before I come to you, Raja, we are pleased to announce that the Wellness and Counseling Committee of the Trinity United Church will be organizing a breast screening exercise this Sunday, the 23rd of October, 2022, at the Youth Development Center after first service. That will be around 9:20, 9:30. Both men and women are encouraged to try to make time and ensure that their breasts are checked. Remember, early detection saves lives. Raja, we'll take your comments now.
Early detection saves lives.
That's it.
That's it.
We'll take it. Bridget.
Okay. So when I came in, I heard about the sucking of the breast when it comes to men, whether it has any relation. The ideal thing is for you, a husband, to see or notify how your wife's breast looks like, so that when you go close to it this day and the following day, you see dimpling, you see any lump and all that, not for only the pleasure. Okay, you notify her. So that is when men come in when it comes to detection of these signs. All right, so I'll emphasize on the Pink It with Brie and Friends. That is coming up or coming on 22nd of October. That's just this Saturday. We are going to screen our mothers and then get to know those who have these signs and then refer them to hospitals to get their breast checked, and then we take it from there.
Thank you. I'm sure we'll all Pink It with Brie.
Sure.
We have another announcement. Are you falling or standing in your relationship? How do you get out of a toxic relationship? How do you save and spice up your relationship? What does a healthy relationship look like? To find these answers and more on Relationship 360, you are invited to the Young Adults Fellowship Relationship Talk with Pastor Sebastian, a professional relationship coach, scheduled as follows. The date will be Saturday, November the 12th, 2022, time 5:30 p.m. at this same Youth Development Center. The Young Adults Fellowship, I beg your pardon, is a group in the Trinity United Church. So we have goodies, so many goodies. The breast screening this Sunday, and then the relationship talk on November 12th. Everyone is invited. There's another announcement we have. Another group in the Trinity United Church called the One Voice Incorporated is inviting all of us to their yearly musical concert dubbed One Concert this Saturday, the 22nd of October. The concert will start at 6:30 p.m. prompt, and the theme is Be Still and Know That I Am God. We are inviting all of you, and we should try to make it a point to grace the occasion to praise and worship God, because He has done so much for us. If you are watching or you are here, you don't have breast cancer, I think that's enough reason why you should come and, thank God and say everything that's on your heart. Thank you, ladies.
You're welcome.
I'm still hurt that I didn't wear pink.
Next time.
Better. I'll do better next time. Thank you. My name has been said in Togo Lamadeko. I'll share some things I learned. I'll reinforce it that the breast extends to your armpit. Get checked as often as you can, and in 2 years at the most, you can see a health professional to do a proper screening. And let's try to take advantage of these screening exercises that are going on. Don't wait till October, lapses, and you say, oh, I should have done it. Oh, it is very important. If you notice any changes, please visit a healthcare facility to get checked. And we learned something. It was in French, actually. She said, peau d'orange, the skin of an orange. If your breast is beginning to look like that, the color is changing, you said it must move in synchrony. I'm borrowing your words. If you lift up your hands and your breasts are siblings and not twins, they don't have to be the same, but they should be similar. So if one is behaving in a way and the other is not, it means you need to, seek some help or health advice. Thank you for joining us. This has been Let's Talk About. Join us same time next week for something more interesting. Have a good night.